What is one thing George Lucas, Ernie Green, Sheryl Crow, and Olivia Newton-John all have in common? They have all at one point in their life been diagnosed with breast cancer. Breast cancer is a really common cancer, and many men and women are diagnosed with it every year. Chances are you or someone you know will be diagnosed with it in your lifetime, which is why this presentation is meant to inform you about what exactly breast cancer is, how it is detected, and what your options are to treat the cancer. Breast cancer is a malignant tumor that first appears in your breast tissue. Like every other cancer, it starts in the cells. It begins when the cell has damaged DNA, so when it replicates, more and more mutated cells collect until it forms a lump or tumor in the breast tissue. In the United States, 1 out of every woman is diagnosed with breast cancer. 220,000 women are diagnosed with breast cancer every year, and 40,000 of them will die. Which means every 3 minutes, a woman is diagnosed with breast cancer, and every 13 minutes, someone dies of breast cancer. Breast cancer is the most common cancer for women to be diagnosed with, and is the second leading cause of death among women. Then, for men, 1 out of every 1,000 men will get breast cancer, which is about 2,150 men a year, and 410 of them will die every year. The reason it's a whole lot less common in men is because they have less breast tissue than women do. Breast cancer can spread throughout the whole body if it's not treated. The signs and symptoms are changes in feeling of the breast and changes in appearance of the breast. And the changes in feeling of the breast are enlargement of pores in the skin or change in skin texture, tenderness of the breast, or a lump in the breast. The changes in appearance for breast cancer are dimpling anywhere in the breast area, shrinking or swelling of the breast, or if the skin becomes red, scaly, or swollen. The symptoms are the same for both men and women. Breast cancer spreads in men a whole lot faster than in women because they have less breast tissue than women do, so they have to be more aware of the changes. Self-breast exams should be done once a month, and clinical breast exams should be done once a year. The self-screening is the thing you do by yourself, and you just feel your breast and see if there's any lumps. And then the clinical screening is when you get a mammogram, which is an x-ray that can detect the cancer before any lumps can be felt. And if there are lumps, then you do an MRI, ultrasound, or biopsy to see if the lump is cancerous. There are many treatments for this type of cancer, such as surgery, radiation therapy, chemotherapy, hormone therapy, targeted therapy, or bone-directed therapy. For surgery, they go in and remove the cancer and the breast tissue, so you have an option of getting breast reconstruction. And then hormone therapy is when they put estrogen in you to try to stop the cancer. And then targeted therapy is when they only go to one directed area, and bone-directed therapy is is used when the cancer has reached the bone and they have to go all the way in and get it out. The side effects vary greatly depending on how often you receive treatment and how healthy your body is. And the type of treatment you receive depends on how serious the cancer is. Overall, breast cancer isn't something to be taken lightly. It is something that can happen to anyone, and thankfully there are many different ways to detect it and various options to treat cancer. Remember to always be aware of your body so you know how to detect it early so you have the best chance at beating the cancer. Knowing is not enough. Now that you know about this cancer, pass it on.